CPR can keep oxygen-rich blood flowing to the brain and other organs until emergency medical treatment can restore a typical heart rhythm. Let's break down the DRSABCD meaning. DRSABCD stands for danger, response, send, airway, breathing, CPR, defibrillation. Each of these is a step, often quite a detailed step, that should be applied when providing first aid.
Emergencies can happen anywhere at any time. Be better prepared today. By following the simple step-by-step process, known as DRSABCD, to help assist you in a time of an emergency situation. D stands for danger. Always check the danger in the environment, any dangers to yourself, the bystanders, and then the injured or ill person. Make sure you do not put yourself in danger when giving assistance to another person. Dangers include vehicles, falling objects, and people. Response. Is the person conscious? Do they respond when you talk to them, touch their hands, or squeeze their shoulder? If they do respond, assess their injuries and keep them in the position you have found them, and apply first aid if needed. If they do not respond, continue with the letter S, send for help. Call 000. Ask any bystanders for help, and send for defibrillator if one is available. While waiting for the paramedics to arrive, move on to the airway. Is the person's airway clear? You need to check their airway by opening their mouth and having a look inside. If you find any obstruction whilst checking the airway, roll the person onto their side to clear the airway of any foreign material, such as food, vomit, blood, toys, by letting it drain or gently sweeping out the foreign objects. Once the obstruction is clear, reassess for responsiveness and normal breathing. If their mouth is clear, tilt their head gently back and check for breathing. Breathing. Check for breathing using the look, listen and feel method for 10 seconds. Look for the rise and fall of the chest. Listen for normal breathing by putting your ear near to their mouth and nose. Feel for breathing by putting your hand on the lower part of their chest, looking and feeling for the rise and fall. If the person is unconscious but breathing, turn them onto their side, carefully ensuring that you keep their head, neck, and spine in alignment. Monitor their breathing and manage any injuries until the paramedics arrive. If the person is not breathing normally, start CPR immediately. Make sure the person is on a hard surface, face up on their back, then place the heel of one hand in the center of their chest, and your other hand on top. Press down firmly and smoothly 30 times, roughly 2 compressions per second, or about 100 to 120 compressions per minute. Followed by giving 2 rescue breaths to get the breath in. Tilt their head back gently by lifting their chin. Hinge their nostrils closed. Place your open mouth firmly over their open mouth and blow firmly into their mouth. Continue this sequence until the person responds or the paramedics arrive to take over. If the person is still unconscious and not breathing, the defibrillator should be applied as soon as it arrives. D for defibrillator. Defibrillator, or AED for short, meaning automatic external defibrillator, is an easy-to-use medical device that analyzes the heart rhythm, and if required deliver an electrical shock to put the heart back into a normal heartbeat. They are available in many public places, clubs and organizations. When applied, just follow the voice prompts until the ambulance arrives. If the person responds, turn them onto their side and tilt their head to maintain their airway and continue to monitor, or continue the cycles until further help arrives.